In our first community conversation today, we're joined by Dr. Nisha Hosadurg, cardiologist at UVA Health. She's sitting down with Aaron.
Dr. Hosadurg, thank you for coming in today. Nice to have you.
Thank you for having me.
You're very welcome. So we're talking about heart disease, specifically heart disease in women. So how do heart conditions present differently in women than men?
Yeah, so while women can still have common conditions like heart attacks and heart failure, they're also more prone than men to certain specific unique conditions. So some things like coronary microvascular disease, which is essentially a dysfunction of the small blood vessels supplying the heart muscle, and things like coronary artery dissection, which is basically where a tear in the blood vessel wall can cause heart attacks even without plaque buildup.
And then do women have different risk factors for heart disease?
Yeah, so traditional risk factors like high blood pressure, high cholesterol, diabetes, smoking all still apply to women as well. However, they are also more likely to have additional risk factors that are often under-recognized. So issues like a history of preeclampsia or high blood pressure during pregnancy, gestational diabetes, preterm births, premature menopause, all can increase women's risk of heart disease. Autoimmune conditions, mental health conditions, which women are more prone to as well, can increase their risk also.
And then what about symptoms? Do symptoms typically look different in women? Do they experience different symptoms?
So they certainly can have different symptoms. Chest pain, like we typically expect, can certainly still occur in women, but they can be more prone or more likely to present with things like shortness of breath, back pain, fatigue, low energy, dizziness, as well as potential manifestations of heart disease. Now, having those doesn't always mean they have heart disease, but does warrant some evaluation.
Got it. And then speaking of evaluation and care, tell us more about the care that's available through the UVA Health Women's Heart Program.
Yeah, so at UVA Health, our Women's Heart Program is a multidisciplinary clinic. We have expertise and are able to treat a range of conditions, including issues like heart disease in pregnancy, specialized conditions like coronary microvascular disease, coronary artery dissection, as well as provide preventive care. We do provide sort of advanced non-invasive imaging, including things like stress cardiac MRI, stress PET scans, and I want to highlight that we are the only center in the region performing something called coronary function testing. This is a benchmark test that can accurately diagnose the potential causes of persistent cardiac symptoms. So things like coronary microvascular disease or that small vessel dysfunction, possible spasm of the heart arteries can be accurately diagnosed by this method.
Oh, that's wonderful. I'm glad that I'm glad that care is available. That's good to hear.
Absolutely.
Well, thank you so much, Dr. Hosadurg, for coming in today. It was great having you.
Yeah, thank you. It was great being here.
Thank you so much. Steve?